3 persons will die in the time it takes for you to hear this story from an AIDS-related illness. 5,000 will die by the end of the day. By the end of the year, the death toll will be approximately 2 million. In Jamaica, 3 persons are infected with HIV each day. 1,000 will die at the end of the year. According to experts, HIV continues to spread due to a number of factors: unemployment, persistent poverty, the growth of the commercial sex trade, lack of donor funding and proper health care, all shadowed by increased challenges to human rights. Hence the theme of the International AIDS Conference now underway in Vienna: Rights Here, Right Now.
We are currently supporting 2.8 million people on treatment, antiretroviral treatment around the world. We've supported more than 7 million people on TB treatment and have helped countries to distribute more than 120 million mosquito nets. We see the first results in the countries that infection rates are going down, that mortality is going down from AIDS, tuberculosis and malaria. And that is our main argument to the donors, to say, look, this is an excellent investment. The health of people and the lives of people, we've saved about 5 million lives so far, and that's why they should continue to contribute to the Global Fund.
The cut in the Global Fund will affect Jamaica and the Caribbean.
In Jamaica, for example, we have committed about $40 million to AIDS programs in Jamaica. We are currently supporting about 7,000 people on antiretroviral treatment, but also a lot of prevention programs in Jamaica. So we are committed to increase the funding also to the Caribbean, because we know it's a big priority, and we will appeal to the donors that they contribute to the Global Fund, but we also need your support, in a sense, to speak up and tell donors that these programs are important for your countries, that they are achieving results, and that we need these resources.
20,000 scientists, world leaders, advocates and persons living with HIV/AIDS are in Vienna for the conference. A call to action on human rights, universal access to health care, funding and ultimately finding a cure for the disease are the key themes that will be discussed over the next 5 days.
Now we are talking a lot about universal access. That was a commitment of the G8 and of the UN. We see that we have not reached the target in 2010, and we need to redouble our efforts, because there are still many people who are lacking access to prevention, care and treatment, and we really have to work hard together to make sure that every person has this life-saving treatment and access to the right prevention.
There is a great level of optimism, tinged with a hint of caution.
I am not optimistic about what the government is going to deliver. What are the governments going to deliver, and what are the development agencies are going to deliver? The same things I had in Bangkok, the same things I had in Toronto, the same things I had in Mexico are the same statements I am hearing here in Austria. And for me, I am asking myself, if people didn't deliver in 2004, what is it new that they're going to deliver and they knew the same message? It is just cut and paste on the same statistic, cut and paste on the same commitment, and I'm very, very disappointed.
I'm moderately optimistic, I would say, because we have a number of countries that say, in spite of the economic crisis, we will increase our funding. But at the same time, I'm also concerned, because there are, as you said, many different priorities, and it is more difficult for countries to donate.
Whether it's seen as a success or a failure, the conference is a significant milestone.
It's significant for us because we're now at our 3rd International AIDS Conference, and it signals a level of development for the CBMP and for the region. And journalists like yourselves who are here are being able to get far more services made available to you. We're certainly more selective and strategic in what we cover and what we're going to do at this conference than we were able to be in the early days, when we were really literally simply exposing you to the experience of the conference. Now we can decide, here are the things that are important for the region to cover, and this is how we are going to cover it. These are the stories we're going to send back to the Caribbean.
Reporting from the 18th International AIDS Conference in Vienna, Austria, I'm Carol Francis for JNN.